Hey guys, well, no blog series from a physiotherapy practice would be complete without some discussion about injuries. And so today I just wanted to talk briefly about the three most common running injuries in my experience being Achilles tendinopathy, a hamstring strain, or a calf strain. And I want to link it all back to the previous videos that we've shown you as far as things that can make you run faster or help you run faster, and the drills that we demoed in those previous videos as well, so you can see actually how complicated running and injuries related to running can actually be. But if we look briefly at Achilles tendinopathy to start with, and we can see here factors that contribute to that are strength or lack of, in the calf muscles generally, but also in the other muscles of the posterior chain, the glutes, the hamstrings, fatigue of those muscles. I think a lot of people, when they're thinking about running and distance running, tend to think about, am I breathing heavy? And it's not a good run unless I'm out of breath. But if your calves run out of breath really quickly, then and you keep going, you're going to load up something, and at some point it's going to break. And usually that is where the Achilles tendinopathy ends up coming from. So it could be because of a sudden increase in the amount of running you've been doing, or it could be overuse. And I've just asked the question here, potentially, is overuse related to these other factors? So did overuse only happen because you weren't strong enough, or because you didn't have enough endurance capability in your calf, or because you weren't very good at the skill of running that we talked about in the Practice Makes Perfect video? So in order for us as physios to either stop you having an Achilles tendinopathy problem or rehab you from that, we need to have a look at all of these factors here. And a lot of those factors can be similar for a calf strain. Is your calf strong enough to run as fast as you want? Does it have enough endurance in it to repeatedly run as fast and as far as you want? Are you any good at the skill of actually running? Or do you just produce all your force from the calf rather than using your whole leg? Have you hurt your calf before? Usually a big risk factor for a calf strain. And this one is a bit less research consistently backed, but potentially still a factor as well. If the movement in your ankle is restricted from perhaps too much training, then that could change your ability to use your strength or where the muscle gets loaded up, which could lead to straining your calf rather than hurting your Achilles. The final most common injury related to running in my experience is hamstring strains. So there's a lot of research currently about the strength aspects of it, whether that's Nordic hamstring strength, Romanian deadlifts, or isometric strength. But again, we have to think about, if you're a footballer, for example, do your hamstrings specifically have enough endurance to tolerate playing 80 minutes? Not just your lungs. Are you no good at running, as we've discussed previously? And I've seen plenty of athletes at the NRL level that were strong, their hamstrings were fit, they didn't have any particular tightness, no issues with their anterior pelvic tilt, which can, like the ankle aspect here and the ankle aspect here, can just change the starting point for your hamstring muscles. They have done lots of hamstrings before, but they've ticked all these other boxes off until you look at them run and they basically skip their glutes and just get all their hip extension from their hamstrings, which then means the hamstrings fatigue quicker and get weaker because of fatigue, and then that's when they suffer another hamstring strain. So if we slide across here to the keys to running fast and we expand that and zoom out a little bit, you can start to see how complicated all this gets with the keys to running fast and their relationships to running injuries, and then, as we've demonstrated in the previous videos, the different drills that we can add to try and work on those things, and some of the coaching cues to try and do those drills. But when you see it all like that, it makes you realize why running is such a complicated task and why people get injured a lot. And we should think of it as a complicated task. I think too many physios underemphasize how difficult it is and how big a deal it is. And I know I've given a video series the last few weeks, but it's a basic starting point and something that people spend years and years and years learning how to coach properly and teach. But some big starting points there. The graphic is in the blog post below, and if anyone's got any questions, feel free to hit me up via Twitter, Instagram, or email. And otherwise, have a great weekend.